दोस्तों, स्वागत है आपका डोमेस्टिक बॉय की। दोस्तों, हम दोनों ने लाया है वर्चुअल मल्टी हॉस्पिटल सिमुलेट। तो शॉर्टकट है इस गेम का।
Select surgery.
सर्जरी को सिलेक्ट करना है जो
Meet John. He has excess hair on his back. He tried many hair removal treatments, but the hair is only removed at the skin level and it tends to grow back so soon. He wants to get rid of this, so we decided to give him a laser hair removal treatment, as it will help John in removing or reducing the hair permanently on his back. First, we need to protect the patient's eyes from intense light that will emanate from the laser.
यस
Drag the goggles to the patient's eyes.
तो कर दिए गॉगल ड्रैग। दोस्तों, इस
To
वीडियो
get
को लाइक
things
मत
started,
कर लाइक
we
करना
need
मत
to shave
भूलना।
the treatment area.
चुप रहना।
Pick the shaving cream and shake it until it is ready to apply.
हो गया पूरा कवर, इधर तक ही मारा तो भी।
Pick the razor and
Razor?
carefully shave the treatment area.
इसको शेव कैसे भी कर सकते हैं अपन। इसको लेजर कटर बोलते हैं। और ये भी ये हेयर रिमूव करने के लिए वो डॉक्टर के पास आया है। कैसा आदमी है। उसको इस पे नहीं जाते आता था क्या बोलते थे वो वैक्सीन की दुकान में, इधर आ गया था। ट्रांसप्लांट करना है उसको कुछ।
Perfect.
कुछ किए भी नहीं।
Now we need to apply topical anesthetic to the treatment area
करना था उसी
to reduce the amount of discomfort our patient may feel. Pick the anesthetic ointment and apply it to the treatment area. Now that the topical anesthetic is applied, we need to wait about 30 minutes or so to go further.
हो गई 30 मिनट्स।
The most important step of laser hair removal. Tap indications to get rid of the unwanted hair.
जड़ से उखाड़ दो मुसीबत को।
Please pick the laser and use it where indicated to cover the whole area.
उसको कितना दर्द होता होगा रेजर मारता तो। एक डिजाइन निकाल दी। इसको बहुत देर लगती लगता मुझे। पूरा सुझा देंगे इसको अपन। इस वीडियो को लाइक करना मत भूलिए और शेयर करना मत भूलिए और हमारे चैनल को सब्सक्राइब करना भी मत भूलिए। एक रह गया है।
Perfect. After the procedure has been completed, patient's skin may appear red or slightly irritated. Don't worry, it will last only a day or so. Immediately after the treatment, we can apply cold compresses to the treated area to avoid any discomfort our patient may feel. Pick the ice bag and apply it to the treated area.
हो गया।
Well done.
नहीं आएगी। अब ऐसा
Meet John. He has excess. Select surgery. Meet Jack.
हम नहीं
First,
करेंगे।
we need to administer a relaxing sedative. This will make the patient drowsy,
देखो इधर
but will
बैंडेज
not
कैसा
put
दिख रहा
him
है।
to sleep. Please,
इसको
now, rub alcohol wipe over the vein, to sterilize the area.
इधर से ऐसे है क्या? मैं उल्टा कर रहा था।
Please, put it where indicated, to administer the sedative through the IV. Tap the needle to remove it.
बी
Please, apply the IV tube. Pick up the bandage. Apply the bandage.
पूरा भी नहीं लगा है। क्या करूँ?
Apply the bandage. Well done.
वेल डन। तुझे बोलना पड़ेगा।
Just prior to surgery, additional drops of anesthetic are applied. Pick the dropper, place it near the patient's, tap the dropper to add anesthetic drops into the patient's eye. Well done. Now use the speculum to hold the patient's eye open wide, during the procedure. Please pick the speculum. Place it near the patient's eyes please. Tap the speculum. Well done.
कितनी बड़ी आँख होती है।
Now that the patient is anesthetized,
बाप रे।
we insert a syringe into the eye. Pick the syringe. Place the syringe where indicated. Now tap the inject. As bubble expands, it pushes the retina back against the wall of the eye. Well done, doctor. With the retina back in place, we can now seal the tear using a freezing probe. Freezing probe freezes the tear back in place. It may take several touches depending on the size of tear. Pick the freezing probe. Use the freezing probe where indicated.
क्या करना है? Use
The tear is now repaired. Tap the speculum to remove it from the eye.
अब क्या करूँ?
We are done. Good job, doctor.
तू ही डॉक्टर है।
For recovery, patient needs to wear the biggest part of the recovery. You did a great job.
अरे
Well,
जाने
select surgery.
गॉलब्लैडर नहीं पहले इसको डेंटल ब्रश
Meet.
मैं नहीं मीट करूँगा।
We will start by polishing all the teeth, making sure there is no debris on the teeth, so that the braces can properly be cemented to the patient's teeth.
मैं आज से
Pick the
गेम
polisher,
चालू
please.
कर
Rub
रहा
the
हूँ।
polisher over the teeth to clean up. Good job.
पीले ही चाहिए उसके दांत तो पॉलिशर बोलते हैं।
Now, we need to put some molar bands to anchor the braces. Molar band is a ring of metal that is cemented on the tooth, usually in the back of the mouth. They circle that. Please pick the molar bands one by one and place them where indicated.
इंडिकेटर भाई बच्ची दांत उसके
Great.
ठंडी तोड़ दूंगा उसकी।
Now, we can start putting the band of brackets on the rest of teeth. We have placed the lip guard over the teeth.
ब्रैकेट
Let's rinse off the teeth. Pick the dental water pick, please. Use it to rinse the teeth.
मुझे पता है क्योंकि मैंने ऐसे बहुत सारे देंगे दांत के उधर डाल रहे हैं अपन और उधर उधर के कैसे है दोस्तों ये लोग भी कैसे गेम बनाते हैं।
Pick the suction. Remove the water.
सर्जिकल सेक्शन गुड जॉब।
Let's press some air to make the teeth dry. Please, pick the three-way syringe. Use it to dry the teeth.
इधर दे तो नहीं चलता, इधर दबाए तो चलता है।
With the teeth dry, we will now put a small amount of bonding agent on the teeth. Bonding is resin material that we use to make a dental composite filling material. Adhere to both. Dentin, pick a tool with bonding agent. Apply bonding agent on the each tooth where indicated.
इसके बाद आखिरी की सर्जरी होगी। हो गया।
Let the bonding dry for a minute or two so they don't get sticky. Then we will place band of brackets onto it.
Okay.
Please pick the brackets one by one and place them to all the teeth where indicated.
कितने ब्रैकेट है तुम्हारे पास? मैं सब चुरा के ले जाऊंगा और मेरे टीथ पे नहीं लगाऊंगा, उसको फेंक दूंगा। तुम्हारा नुकसान होगा। मुझे हुक्म दे रहे थे। अपन पे हुक्म नहीं चल रहा। कोई बड़े है, कोई छोटे है, कोई बहुत छोटे है। क्या ब्रैकेट? खुद डॉक्टर है और मुझे काम कराने लगा। मुझे इनकी ये बात नहीं अच्छी लगी कि डॉक्टर लोग दूसरे इंसानों से काम कराते हैं। हो गया?
Now, use the curing light to cure resin-based composites.
दाद देखो उसकी कैसे है।
Pick the curing light. Please use the curing light where indicated.
इंडिकेटर।
Well done, doctor. Now, it's time to fit arc wire. The arc wire is a thin wire that fits into the bracket slots and connects the teeth. Please pick the arc wires one by one and move them to the mouth to put them in place in the individual brackets.
हाँ पता है मुझे ये क्या है। ये शेप में ला रहे हैं इसको। ये पिन है।
Well done, doctor.
मैं डॉक्टर नहीं, तू डॉक्टर।
We do not want the wires to hurt our patient, so I have already cut the end of the arc wire tied against the last bracket or molar tube using distal end cutters. Now, we will use elastic ligature to make sure the arc wire does not fall out of the band. Ligatures are small elastics that are placed. Please pick the elastic ligatures one by one and place them on the all brackets where indicated.
अरे बाप रे, ये वाला काम है तो पर उसके लिए तो बहुत सारा करना पड़ता है। इंडिकेटर पहले अपर साइड के कर लेते हैं, फिर लोअर साइड के करेंगे। अपर साइड के ज्यादा दिखते नहीं है। क्यूटिकल इसमें ही ज्यादा देर लगती है। ये देख रही है अपने मुंह के पास।
We are done. Good job, doctor.
देख उसे
In the next few days, She might experience discomfort. Eat softer meals. Brush and many patients ask, how long will it take to complete the treatment? Time spent preparing your mouth for braces, your age, well done.
So, meet. Our patient is already under general anesthesia. Now, we are going to make 4 small incisions, one right below the belly button and 3 others, right over the upper abdomen. To do this, first, we need to disinfect the area. Please pick the iodine, rub it to sterilize the area.
बोलना नहीं आता उनको। हो गया?
Pick the staple, put it where indicated, and drag it to make a small incision, right below is good work. So first, we need to use little carbon dioxide, to inflate the abdominal cavity. Please pick the CO2 to attach it to the trocar. Now, we will use laparoscopic camera, that will help us to see, close-up view of the organs and tissues. Please pick the camera. Insert, you are doing a great job.
मेरा जॉब नहीं है, अब क्या करूँ?
I take care of other incisions for laparoscopic tools. Now that all of the tools are in place, can you move the liver out of the way using the clamp, so that we can get to the gallbladder? Please pick the clamp. Tap the clamp, to move the liver exposing the bladder. Good work. Before making any incisions into the gallbladder, we need to clip off the bile duct in 3 locations. Please pick the forceps. Place it where indicated, to sever the bile duct. Great. Now, use the scissors to sever it. Please pick the scissors. Place it where indicated, to sever the bile duct. We need to cut gallbladder from the liver bed. Let's use electrocautery device, to minimize bleeding. Please pick the use it where indicated, to separate the gallbladder from the liver.
क्या आता है? ओके।
Fantastic. Let's take the clamp to the cannon to the belly button and pull the gallbladder out. Tap the indication to remove the gallbladder through the incision. Well done. Our scopes shows that everything's clean. We've removed the gas. So, please pick the scalpel. Use it where indicated to shut the incisions.
Staple. इनको ब्रिटिश
Well done. Our
तो दोस्तों आज के लिए सिर्फ इतना ही।
Select surgery.
खत्म हो गई है तो हम ये करेंगे कि दूसरा गेम हम डाउनलोड करके आपको दिखाएंगे। तो आज के लिए सिर्फ इतना ही।